participants. Today we will be talking about availability of opioids. I'm sure in the previous sessions, the other faculty would have discussed why opioids are important and why there is so much of need for palliative care, not only all over the world, but specifically in India and other developing countries, and what are the particular challenges that we face. So as we go along, we will be discussing a bit of these. At the end of the session, as usual, we will be taking questions and answers. Usually at the end of this session, there are many questions regarding practical problems. So please note them down and we'll take them one by one. So why it is important is because I'm sure you already know that 2/3 of advanced cancer patients and lots of non-malignant conditions like HIV, CHF, COPD patients, all of them have lots of moderate to severe pain, which affects not only their physical functioning, but also their family life, their social interaction, affects the community as a whole. It leads to existential distress, not only for the patient, but also for the whole family, doubles the risk of suicide in case of uncontrolled pain. And it's just misery for everyone involved. But the problem is that we take pain for granted. And even during our training, we just generally think that pain is just a part of the disease that the patient has to suffer. So it remains undertreated. It is not adequately recognized. It is not adequately assessed. And as a result, it is incompletely treated throughout the world. And in India, we have less than 4% patients getting proper relief. A lot of times the pain is due to the disease, but many times it is because of the disease and the treatment itself, and forms the entry point into palliative care for most of our patients. And there are many studies to show how difficult it is. Like one study was there which shows that oncology fellows fail to appreciate the severity of the problem in 73% cases. But there is no quantitative study that can convey the personal and the family tragedy that results because of this uncontrolled pain. There was another study in 2012 to 13 in 4 major cancer hospitals, which showed that though 88% patients came with pain, but almost 67% got inadequate analgesics. And though opioids have been on our national list of essential medicines since 2003, but the problems regarding availability still remain huge. And although pain relief is acknowledged as a fundamental human right, and it is said that pain relief, if we are not able to give that to our patients, it is as bad as torturing somebody. India is the legal producer. It is the biggest legal producer among all the countries of the world. But 6 countries of the world, and mostly Western countries, Australia, Britain, Canada, France, US, and Germany, they consume 80% of the world's morphine, and the poorer and developing countries, which have 80% of the population, they're able to get only 6%. And though it has been on the WHO's list of essential medicines since 85, our domestic consumption remains very little in spite of our heavy burden of patients. And there is a lack of demand because doctors are not trained to use it, and there is a huge fear of addiction. Also, the fact that till 84, the laws were very strict, very stringent, and they led to a lot of problems with the availability. There was a UN resolution in 2005 which said that medical use of opioids is indispensable for relief of pain, and that morphine should be available at all times in adequate amounts and dosage forms for all hospitals, and that any country with a low national consumption of opioids, it's a matter of great concern for all concerned. How concerned should we be in India? Now, this figure comes from the Pain and Policy Study Group, the University of Wisconsin, which shows that if you look at the graph, Australia, this is the per capita consumption of morphine. Austria is somewhere on the top of the graph. US is here, UK is here, and for India, you have to look really, really hard and you'll find it somewhere at the bottom over here. Then this is another figure which was given by the INCB, that is the International Narcotics Control Bureau, which found that almost 80% of cancer patients have deaths with moderate to severe pain, and 50% of HIV patients die with moderate to severe pain. These patients require almost 679 milligrams of morphine in the last 3 months, but our actual use is only zero point 0.4 milligram percent. So you can imagine the amount of uncontrolled pain we have. One big problem during the training in recent years has been our emphasis on cure. Uh, so much of medical practice has changed with its stress on diagnosis, investigations, that is, so that care is relegated to the background. And as a result of the fact that morphine has not been, opioids are not available for teaching, there is no stocking and dispensing in medical colleges and hospitals. So almost two generations of doctors have grown up without actually using morphines. So it is there sometimes in ICU, it is there in CCU, but use of injections in ICU and trauma is very different from the way we use it in chronic pain. Old NDPS rules were there. I told you they were very strict. So you needed a number of licenses for uh, transporting, for storage, for transport from one state to another. And there was so many departments were involved: government, excise department, revenue department, and uh, this resulted in a lot of incoordination and difficulties. Also, the issues of cost. It is said by the UN, it has been said by WHO that it is obligatory on part of medical practitioners and institutions that we must have it in adequate form and doses at all times. But pharma companies are not interested because there is no profit. Morphine is a very cheap drug, and because of low profit, low demand, a lot of paperwork and bureaucracy involved, there's no profit to be made because of, especially because of low volume of demand. And as a result, this has resulted in pushing off expensive formulations at the cost of the cheaper drugs. If you look at the table on the side, it gives you a comparison of the cost of per day cost of the drugs. So at the time that I made this table, propoxyphene was available at rupees 1.92. Tramadol cost 16 rupees a day. Morphine is very cheap at rupees 5, and fentanyl more than 100. So if you have to get a patch of more fentanyl for 3 days, that packet which has three, it's almost 1500 rupees, which is beyond the affordability of most of our poor patients. Supply of opioids limited only for a few days in many countries still, and long distances, repeated journeys, very difficult for sick patients. And patients, they have to stand in line from morning till evening to get a prescription. And if there is any spelling mistake, if there is any cutting, if there is any overwriting, they send the patient back to the doctor who is already overloaded, and it's very difficult for patients. So there is a lot of evidence for the safe use of opioids in chronic patients. There was a study with almost 12,000 patients, which was done at AIIMS New Delhi. And there was another study which was done in Kozhikode in 2001. And it followed patients over 2 years and found that there were no instances of misuse or diversion when patients were issued opioids for chronic pain. But you have to be careful in selection of patients, and you have to be careful with their follow-up. So as a result of all this, this is the background that I was telling you. So civil society in India took up the efforts to reform the laws and the policies required for opioids. And this resulted in amendment of the NDPS Act in 2014 and brought in the central balance of uh, ensuring balance in the use of opioids was brought in so that it is adequately available for medical and scientific use. What are the main features of this modified NDPS Act of 2015? It has simplified the procedures for stocking as well as dispensing of morphine in institutions. It notifies certain drugs as essential narcotic drugs. There are 6 drugs, we will come to them. And it has made the uniform rules for all the states of India. There is only one agency in each state, that is the state drug controller or the food and drug administrator, who will recognize institutions where morphine can be stocked and dispensed. And this recognition, it's not a license. There is a difference between the two terms. So these institutions are recognized for 3 years. No longer multiple licenses are required. You need only one permission, one recognition from the state drug controller. Some important terms which have been used in this act, which we should know before we get our institutions recognized, is what are essential narcotic drugs, which are the ENDs. These are opioids necessary for pain management, approved by the Drug Controller General of India, and these include morphine, methadone, codeine, hydrocodone, oxycodone, and fentanyl. And the term RMI, that is the recognized medical institution. Now, this is important. It is defined as any hospital, dispensary, clinic, or institution which offers diagnosis, treatment, or care of illness, injury, deformity, anything, which is either established or run by any municipal corporation, municipal council, Zilla Parishad. And again, this is marked in red, any person or body of persons. So this would include any kind of clinic, dispensary, or medical institution. Now, this can be recognized by the state drug controller for the purpose of purchasing, possessing, and dispensing narcotic drugs for medical and scientific purposes. And by definition, all government hospitals are deemed RMIs, provided they follow all the requirements of being an MRI. And we'll come to that. What is an RMI? RMI is any healthcare facility that can purchase, store, and dispense oral morphine. So it should have an officer in charge within the RMI who has been trained. So a doctor has to be trained, a doctor or a dentist. They should have a facility for safe storage of the drugs. A double locking system. Now, what is a double locking system? A double locking system is simply a locked cupboard in a locked room. It does not mean a cupboard with two locks and two keys like we have in the banks. It's not a locker system. Basic infrastructure facilities means safe storage of the drug, basic where somebody can supervise, a place to dispense, a place to keep a record. Enough staff for evaluating and managing patients. And you have to give proof of space and personnel for the record keeping. So they will ask you, when you send an application, they will ask you who is the doctor in charge, what is his training, who is the pharmacist who is going to be in charge, and what is the kind of facility you have. So they might even ask you for a map of the storage facility. So sometimes they ask you to send a map of your pharmacy. It's very simple. You just have to make a simple diagram of the floor space and send. Then a separate register has to be kept for record for consumption of each opioid. Now, if you have 4 or 5 different kinds, like you may have in your institution, injection morphine, tablet morphine, fentanyl patches, tablet codeine. So you need to have a record of all of these separately. Who can be a registered medical practitioner? Any person who is registered as a medical practitioner under Indian Medical Council Act. So either a doctor or a dentist, registered as a dentist, and who have also undergone training in the medical use of ENDs. So a doctor or a dentist who has been trained in palliative care can be a registered medical practitioner. And what is the process of recognizing the RMI? So this is a basic flow diagram that I have made. First of all is that you should have a doctor or a dentist trained in the use of ENDs. Then you apply for RMI status in the given format. After that, the state drug controller will send somebody for inspection. They will authorize your institution as a RMI. After that, you can purchase your drugs. This has to be done from approved manufacturers. You will get a receipt of that consignment. Then keep a record of the stocking and dispensing and file an annual return, after which you can apply for renewal of your RMI status after 3 years. But this annual return has to be filed every year. We will come to the each step one by one. First step is training. So once you have decided that you need opioids in your institution, please get a doctor or a dentist trained. After that, when you send an application from the side of the institution, the application format is Form 3F. Now, these are different forms which are given by the government, and uh, there is a whole set that we will be giving to you after this. So, this PPT will also be there, and all those forms are also going to be there. So, you just remember, you go through this PPT whenever you need to. Form 3F needs to be filled in. This is addressed to the state drugs controller by the authority in charge of the institution. So your MS has to sign. Sometimes the MS might be afraid of signing on anything asking for opioids. So it's very important to have a CME in your hospital and include your administrative staff and MS so that they understand this whole process and they have no qualms about signing the forms when required. So when you send an application, you will have to send details of the trained doctor, a copy of their degree, registration and training certificate in palliative care, along with the Form 3F. Form 3J is an annual estimate. They will ask you how much morphine do you require, how much codeine do you require. For that, there is a way of calculating, and there is a proper format in which you can ask for the amount of drugs that you need. You may want 2000 tablets. You have a bigger institution, you may want 6000 tablets, but that how to calculate and what to write, that is all given in these forms. Again, there's a covering letter. This has to be signed by the head of the institution, and a self-addressed stamped envelope for rupees 27. Now, I don't know why it is 27, but it is 27. After that, once the state drug controller has received your application, they will have a designated person who might want to inspect the clinic or the institution. And once they do that, they will authorize it as an RMI through a letter of recognition. Now, this has a time limit. They have to give you a reply and they have to complete this process within 2 months. That is 60 days from the receipt of your application. Please do ensure that before you send your application, this is a practical tip I'm giving you. Before you send your application, please do send somebody, or it's better that you go and meet someone in that office. Tell them why you want, make a social visit. So you have social contacts, get their contact numbers. And when you send your application, please follow it up. Tell your administrative staff to follow it up with the clerical staff in the state drug controller's office. Otherwise, it will never get done. Application will keep lying in a file. So please do have a social contact, get their numbers and follow it up yourself, or depute somebody, your pharmacist or your office staff, to follow up your application. Now this authorization from the state drug controller comes in the format Form 3G, and they will tell you the quantity of E&Ds that they have allotted for 1 year. They have to allow like 5,000, 6,000 tablets for 1 year. Now that doesn't mean that you cannot apply again. It just means that at any particular time, this is the maximum that you can hold. If you finish, you can ask again. However, if they do not give you RMI status, again, the reason has to be given by them within 60 days of the application. Once you get permission, once you get your letter of recognition, you can order your purchase of opioids to the pharmaceutical agency you want. And these are listed at the website of the state drug controller. The list of approved manufacturers is there on the state drug controller website. So after they have sent it to you, they will send a note, assignment note. You will get it along with a copy of the format Form 3C, which has details of consignment, how many tablets have been sent, from which manufacturer, which date, which is the batch number, what is the stock number, like they do for all drugs, that you will give. They will give you, and after that you receive it, keep a copy, keep the original, and a copy is given back to the supplier. I think this is the standard procedure for all drugs, especially in government hospitals. Now, how to maintain the records? All the records have to be maintained for 2 years from the date of last entry. Every day, have a record where you have to enter the diagnosis, details of the patient. Now, details of the patient should include name, address, diagnosis, Aadhaar card number, phone number of the patient. And if the patient has come for the drugs, then sign of the patient. If an attendant is coming, then take down the Aadhaar number of the attendant and get his signature of receipt of the drugs. A separate record of every patient is to be maintained in the format 3E, and you have to file a return for each calendar year on or before 31st of March in the format of 3I, and this is sent to State Drug Controller. What about private practitioners? People who have their own clinics, who are standalone, they may have small amount of opioids in their own practice without any special authorization. You can have up to 500 mg of morphine, codeine not more than 2000 mg. This is different for each drug, like I've put it down here for your reference. 2 transdermal patches of fentanyl 12.5 microgram or 25 microgram, one each of 25. And if you need more, you can apply with the form 3B to the State Drug Controller, and you can have it if they permit, but that requires a special permission, and this is valid for a period of 3 years. So when you buy these opioids, they have to be purchased from authorized chemists, like I told you. This is available with the State Narcotic Commissioner. ENDs have to be prescribed for selected patients only. And very importantly, they cannot be transferred, loaned, or sold to other institutions except with the written permission of the drug controller. Unused ENDs can sometimes be returned by the family. Now, if a patient dies and they have morphine which is left over, they can bring it back to the institution and the institution can receive them back. Just note down the number, the batch number, the details of those drugs, and take them as fresh receipts. Sometimes it is possible that you may take 2000 tablets, 3000 tablets. You don't have patients like it happened during COVID. The number of patients coming to the institutions dropped, and we had lots and lots of drugs that were not used. But what about ENDs? ENDs, if you need to destroy any expired medicine, it has to be done in the presence of an official designated by the State Drug Commissioner or FDA Commissioner. And it may be possible that in institutions, doctors come and go. So if your trained doctor RMP is going from the institution, any change is to be intimated within 7 days to the State Drug Controller. You have to send it in writing. And a new person comes in, so send their details and get this certificate reissued by the State Drug Controller. Now this is form DD12. This is called DD12. Now this is just to show that sometimes if we do not have opioids in our own institutions, then we can get it from a retailer. And there's a special format that we use. This is called DD12. This is how we fill in the prescription for getting opioids if they are not available in our institution or till they become available in our institution. The name of the patient, the drugs, how they are to be given, and the details of the doctor who is prescribing along with the registration number. All of these have to be given in detail. Recently, there was a change by the FCI which said that all the prescriptions should be in capitals. This was before that. Now, what we do now is try to write clearly in capital letters so it's more legible. But whenever we prescribe, this was another interesting paper from AIIMS New Delhi, which talks about the circle of safety when prescribing opioids. So first thing is total pain. Assess total pain. Not everything is responsive to opioids. Have trust of your patient. Create awareness in the patient, in the family, in your staff, in your administration, so that everybody knows about the need and the need for care while giving opioids. Train and empower your physicians and your staff. Tell them to be responsible when they are prescribing opioids. Availability, it's also part of our job to ensure that they are available, the drugs are available. Society has to be educated, policymakers need to be told, law enforcement agencies need to be told, and how to dispense these drugs safely. Our pharmacy staff, our nursing staff, they need to be trained. If patient is in home care, then home care teams and the families need to be trained, and everything has to be done under supervision. Idea is the patient should have total pain relief, and follow up is important. Record keeping is very important. But it's a very, very good, very effective, very safe drug. And record keeping is just as important in other drugs as well. It's just that sometimes we don't do it so carefully. For opioids, we have to do it carefully. And we must remember that strong opioids exist to be given, not merely to be withheld. Morphine, it remains the gold standard for pain relief in severe cases. It has been used for so many years now. It's been shown to be safe, it's effective, it's cheap, and safe, yes, if given by trained people in proper manner. And we have to give it according to the severity of the pain, not the stage of the disease. So sometimes we may think that patient abhi to bahut early hai, patient may need it later, and patient insists that he's got severe pain. Please remember, patients even in early stages of disease can have severe pain, and sometimes after treatment, after radiation, after surgery, the pain may go down. So he may not require that opioid. And also that it's very important to make available normal release morphine in your institutions before making available the other more expensive formulations. But what happens practically in every regional cancer center and medical colleges, you will find that oral morphine is not there, and fentanyl is easily available. Everybody likes to write fentanyl, whereas fentanyl is a second line drug. It's not the main, it's not the primary drug. So it's a good drug in cases where patients are not able to take orally, but we must always start with normal release morphine. So we have to make available normal release morphine because fentanyl and morphine are both covered by the same NDPS rules. What happens is you look for normal morphine, you won't find, and for fentanyl, the MR will say, "Oh, हमें patient का घर बता दो, where it is, we will deliver," because the profit margins are more. So what do we do about it? What do we do about increasing opioid availability? We have to make, as I said, awareness for health professionals, patient, policymakers, police organizations. Integrate this awareness into all levels of care. It is not just for tertiary care. It is equally important for primary care. It's equally important for secondary care. It's equally important for all branches. It's not just oncology, it is not just cardiac. So please remember to put this thing for your gynae colleagues. Gynae oncology is important. Orthopedics, very important. Pediatrics, ENT, dentistry, it's so important in all branches. And networking. Networking is so important when you need help from families, you need help from NGOs for home care, you need help from geriatric patients, for them you need help from HelpAge India, you need help from whatever organization, Red Cross or whatever NGOs are working in your area. You know, we cannot do home care without help of NGOs in the existing scenario in India. So networking with them is so important, and education and training. What we are doing right now is part of it, but it doesn't end here. Each and every one of you who is trained has to go into the periphery, into your institutions, and help train more people. At least make them aware of this particular branch and why it is important. And research, last but not the least, research. Creating evidence for our own country, for the places that we work in. See, each population is different. So in the East, things are different from what they are in the West. down south in Trivandrum, it is very different from where I work in Tripura. So we need evidence for this particular group of population where we are. And when we work, there is so much of research work that we can do. Tie up with your institutions, tie up with local medical colleges, help the PGs do research on subjects related to palliative medicine, and create evidence for your country. So, as the Dalai Lama says, we should be wisely selfish. Whatever you do comes back to you, and we are all going to die in the healthcare system tomorrow that we are going to help create today. We need people who are going to take care of us when our day comes, and we need opioids to be there for ourselves, for our friends, for our families, for our dear ones when they need it. And for that, we have to work now. We are preparing the ground, we are sowing the seeds, and we may see the results 15 or 20 years later. So be wisely selfish, teach others about palliative care, and help opioids to be available in your institutions and in your communities. Thank you very much. And if we have
That was the recorded video of Dr. Savita Butola, who unfortunately could not join us live today. And as I told earlier, we have two moderators today joining to handle the Q&A session. So for their formal introduction and further facilitation, I invite Dr. Radha Venkateshan over. Ma'am, over to you.
Thank you, Sri Priya. See, this topic is something which is very practical. So you've all had a good information on like A to Z on what has to be done. Okay. And now from here, we can answer all your questions. There are some in the chat box, which we will deal with them too. First, we have Shalini, who is she's basically has a diploma in sales management and also a master's in marketing and HR. She is the head of the state facilitation division. Okay, she is someone who will do anything and everything to get it done. Okay, and she has a very long years of experience. She has more than 20 years of experience in her career, and she's worked with many MNCs, and she has dealt with various aspects, business, development, relationships, so anything, A to Z of HR, I would say. And she's been with Pallium since few years, from 2016, and she's an active member. So she is one who's been implementing this. So all your queries, she should be able to answer. And always, as I say, no, Pallium will take you like all along, will be there for you. We have been telling this all through this 20 sessions. So don't worry, anytime you're stuck also, they will be able to help you. And next we have, are we having Dr. Sridevi also, Sripriya?
Yes,
Yes, okay. Okay, so Dr. Sridevi Vadyar is has obtained her master's in palliative medicine from Cardiff University, and she is the head of education and skill building at Pallium India. She again has at least 10 years of experience as a clinician, and she's been a teacher and mentor also too. And her main passion is getting palliative care to the nook and corner of India. Okay, and she has done her master's from Cardiff University, and she has had clinical excellence, teaching everything in varied forms. And she is one of the faculty, a national faculty for many training programs in the country too. So with that, I welcome both Shalini and Sridevi to be with us to go through the question answers session. And I will just read the couple of messages which are in the chat. First one is 500 milligrams, is it per month or for a year? Or somebody else has said it is 500 at a time. So that's the first question in the chat box for us to take up.
Hi, good evening, everyone. This is Shalini. Thank you, Dr. Radha, for introducing us, both Dr. Sridevi and me, for this group. It's been a pleasure to be on the same platform with Dr. Radha and Dr. Sridevi. So thanks so much. Team, I think right now the question possibly that is already answered in the chat box, more of a doctor-specific question. So I would refer it to Dr. Sridevi, but for more practical issues, administrative issues, I would want to talk to you later. Yeah, Dr. Sridevi, if you can.
Yeah, maybe I joined a little late. So what was the question, Dr. Shivam? What was it about the 500 milligrams?
No, is it 500 milligrams for 1 year or like that five in the presentation it was there, Sridevi, that
Yeah,
if it
I
is
think was it about
individual
ordering
person. See,
the morphine
if it is done by a individual practitioner, like a private person, the allowed amount is 500 milligrams.
Yes. I think Dr. Karthik has answered, like in a bulk, if as an individual doctor, it can be 500 milligram at time. And suppose if you are placing, Shalini, please correct me, if they are placing multiple orders of 500 milligram over a year, for example, they had lot of referrals and they needed more morphine, maybe they have to show the documents telling how many patients they have catered to. Just in case, just keep it, you don't have to show it unless there is any question from their side. Am I right about it?
So I'll just define it a little more. This is more required when you're fitting in, applying for the first time. Generally, we suggest you go in for a half a kilogram for the whole annual period. That's the annual estimate that you can submit for. You can apply and again, or rather put an order straight away to the supplier through the year. But you do not have to go to the state drug controller every time. State drug controller application or the annual estimate is to be submitted only once in a year. That is it. And that can be an estimate only. So it can be a 500 milligram if you're just beginning and you feel that you might not be able to use it much, or you want to test it yourself. That can be just one time, you can say that. But you are always allowed to put an order again to the supplier and inform your drug controller office that you are taking up more morphine because you expected more. This example actually happened with the Swikar Hospital in Tirupati. They had recently started, it's a Tata-run hospital, and they recently started and they applied for a very small amount of morphine. And the drug controller approved it. And then halfway through, they realized they are dealing with so many cancer patients, the numbers are increasing. They really need another lot, which they could have directly asked the supplier to give. However, as we all say, as a social protocol, because in India, drug controllers are still wanting to have that control, still wanted to be informed for morphine. As a social protocol, it's always good to inform them that you are going beyond your annual estimate and probably send a letter to them or an update or something like that from your side. As per legal protocol, you are not supposed to go to a drug controller again. I hope that
in the presentation itself, doctor clearly mentioned, okay, that even for 5,000, what did she say? That's why you have to have your ears, eyes, everything open and full, because she did say, even if you apply for 5,000, you empty that, you can apply that. It's just demand supply. Okay, so you just have to see what is your need. So that's why there's no one thing for everyone. You may be in a place where you're seeing 500 patients, or you may be in a place where you'll see only 5 patients, and both of them are not wrong. So you just need to know how it has to be done, and then take it and then do it as per your need and requirement. So because this was mentioned in the presentation, clearly she did say, that's why I just thought of reiterating, not telling that your queries are wrong or anything like that. But it is all demand supply. It is also another drug. It has to be used sensibly. That's the only thing. And it is a wonder drug for pain relief in these type of patients. Let me see, there are a couple more on the chat.
Yeah, there was another question on, do you need a separate license to procure methadone if they already have license for morphine? So I've answered the question. It is just one license for all the essential narcotic drugs.
And methadone, no, first you should be someone who is very comfortable with using morphine. because it has its own like specific things. You've all had this session on methadone, so you have to know what and how to do, and then do it accordingly. That is what is generally recommended too. You have to use morphine, and then accordingly, if not working or something, and accordingly you move forward from there. And license will be one and the same, because all those 6 drugs which were mentioned will all be covered under that one license.
Maybe just because there are no questions in the chat, and maybe out of my curiosity, how many in this group do not have access to morphine? Just to understand, maybe that will be helpful for Shalini also to understand what and where you are actually stuck with not having morphine. Those who do not have access to morphine, if we can just
Somebody
type
has
it.
put yes. Nilesh, no, Nilakshi, I think. That person has said that he or she doesn't have a license. And is it possible for a dentist to get license?
Yes, that's, I think Dr.
That's
Nilakshi
exactly.
has answered that question. It is possible.
Yeah, that's correct. And as Dr. Savita also mentioned, a BDS and an MBBS is allowed for the procurement of these ends. Once you are trained in pain management and or palliative care, you can be the RMP for procurement of essential narcotic drugs. Out here, the group is belonging to all over. Dr. Ira Almeida. Hello, Dr. Ira. I don't know if you still remember. This is Shalini from Dilasa only. I worked there for some time. So in particular, let's take an example of Goa. In Goa setup, we have already the rules are implemented and they are already RMIs that are issued. So Goa drug controller is issuing that. However, Dr. Ira is in a government setup. So I think that one clarification I would want to tell you that in a government setup, you don't have to apply for an RMI certificate because government organizations are deemed RMIs. They do not require to apply for it. However, you will have to submit the annual estimate, create the documentations which are required for all the other forms where you have to see where the morphine is going, but you will not have to apply to the state drug controller. However, there are exceptions to this because again, a lot of this is happening from a hesitance to allow easy access. A lot of drug controllers are keeping a control, or they are even issuing RMI certificates to government hospitals also, just for their own record. They just want to have, issue a certificate and give it to them. Like in Mizoram, the drug controller is giving the certificate for every district hospital which has started procuring morphine, so that they have it in their list that these all places have morphine or have opioids. So it is not required from your side per se if you're a government institute.
And Dr. Puneet has mentioned that, is it that you don't have morphine? Dr. Puneet, you're from Bangalore, right?
Just for your records, regarding the question you asked regarding the availability of opioids, as per the data we have from the registration, out of the total registrations, 32 participants have said that they do have strong opioids available in their settings, and 21 have said they don't have access, and 11 people have responded that they don't know, they're not sure it. That is the status.
In that case, I think once you want to take this next question by Nilakshi, I work in a corporate setup, so is an RMI certificate needed? Yes, it is needed for any corporate, charitable, any setup which is not government, you will need that. And even if you're opening up a clinic of yourself, you would need an RMI if you want to procure any of the opioids, these 6 opioids. I just want to add here, because as just now Shripriya has shared, 21 people do not have morphine. So that's something that Pallium India has been doing, that what Dr. Radha has also mentioned. There is a facilitation team that we have in Pallium India, where each facilitator in a region is working with the drug controller of that state. First, what they do is they ensure that the drug controller has implemented the new rules so that they are aware of that, yes, these opioids have to be procured for medical use, and they allow it to happen. So once that is done, they go to the next level of working with medical institutes. So these facilitators can work with you if you want to apply for an RMI to your drug controller. You might not be knowing how to connect to the drug controller. If you connect to our facilitator, they will help you fill the form. They will help you submit to the drug controller's office, and they will help you follow up with that also. So that kind of connect that Pallium India team has maintained with the drug controller's office. Majority of states in India are now having the RMI certification. There are only very few states, like Dr. Savita was mentioning, Tripura. It is very difficult to get an RMI certificate. That's not something, it's very easily allowed. Another thing we are doing here is we are going for opioid availability workshops. We conduct for every state an opioid availability workshop where we invite the drug controller at one side, and we invite the medical fraternity of that state. You know, all the hospitals, all the institutes that we know, they come and they discuss at one platform. So if you want to have it for your state, then we are happy to conduct one opioid availability workshop if it has not already happened. If it has happened, then simply our facilitator can help you apply for the RMI.
Shalini, Dr. Puneet is working in a medical college in Bangalore. So I think that will be very easily doable from your side. I'll connect you with Dr. Puneet for his institution. They've already applied, enrolled for the faculty development program also. We already have trained people from their college like months back. So there shouldn't be any issue in getting morphine there. So I'll share the contact of Dr. Puneet with you.
Sure.
And Christy V.
Before that, Dr. Sridevi, I'll just take just to assure you and give you a little relaxation. Karnataka is a state which has started issuing RMI. So there is not going to be a problem from the drug controller's office in terms of that they are reluctant to give you, but they have already started the process. So if you need any help in the follow-up or connecting with them, we are happy to do it. Otherwise, even if you will apply directly to them and do a strong follow-up with them, they will issue you the RMI.
Dr. Shivam, which state you are from?
Dr. Shivam Singh, which state are you from?
He's from Uttar Pradesh.
Uttar Pradesh. Sir, we are already in very close contact with Uttar Pradesh State Drug Controller. There are a lot of RMIs we have facilitated there. So I would suggest if you can, should I just put in the numbers of the regional facilitators in the chat box. For Uttar Pradesh, again, it's already implemented. You just have to apply to the State Drug Controller. We are trying to have an opioid availability workshop for Uttar Pradesh also. The moment we have it, most probably Dr. Raj would be speaking on it. So we will send the invite to you. This is the list of regional coordinators. We also now started calling them regional facilitators. They will get in touch with the drug controller. They'll help you submit the RMI to the drug controller and help you follow up with them. So Rajendra is for you, for UP, Dr. Shivam. So you can reach out to him and note down his number.
There is a question, Christy Severa, I think. Can we have opportunity of training in palliative care practice in India through Pallium India? If yes, how can we do to apply? For whom is that person asking?
Which country are you from, Christine?
She is from Kenya.
Okay.
Okay.
So we do have opportunities for being an observer with us. You can choose to come over and spend days, weeks, or months with us. as a learner. We have a global fellowship program that happens once in a year. You can apply for that. So as a part of that program, you are, it's a compulsory posting here for a period of 30 days. Irrespective of the global fellowship, anyone in this group, we will be sharing, or we have already shared hands-on training partners in all the states that you are coming from. So if you feel that you need to see all the practices that has been taught in these sessions, either write to us, or we have given all the contact details in that document. Just get in touch with the hands-on training partners and go there and see how it is being done on a ground level. Like, how do they do the IV morphine titration, or how do they do the communication? How do they give end of life care? How the medicines are being administered? So all these things can be seen and experienced firsthand. Christy, yes, we are so happy to help you in translating and conducting training programs for your people there. Definitely, we can have a conversation. We won't be able to translate, but we are free. We are happy to share whatever resource materials that you want to have from us. We're happy to get you connected with people working in Kenya, people who have already trained, or people who are already working in your region. We are happy to put you in touch with all this.
Sri Priya, like when we had the session last time, no, regarding the information on hands-on training centers all over India, I think that was not shared on that day. Has that been shared with all with the group?
No, it will be shared after.
It has not been done. Please do that, Sri Priya. That will be good for the rest of them also, please, because that's what I remember.
It will be
that
done tomorrow or on Monday.
Okay, okay.
I'm waiting for the sessions to get over.
Okay, then, because that was just, I thought, not done. So just to make sure it's done.
I strongly recommend every one of you to take a few days out and just, if possible, be with the hands-on training partners for a few days. It will be a very different experience than learning from the virtual sessions. You will learn more even within a short period of time. So I encourage everyone to do the hands-on training also.
Sridevi, in fact, I told them must. Because no, that will only give them confidence. I was telling them it is like part of the training. What they have, all this knowledge gained with that hands-on experience will make them more confident, very comfortable. That will start the enthusiasm in them to go ahead and do. So they have to see to believe. So I've been telling them minimum 5 days, 10 days, very good.
And with all the states we have the centers, the language will not be a problem. You will be able to communicate with the patient with your own language.
Are there any batches for hands-on training?
Yes, yeah. I think you can apply. You can contact directly with the hands-on training partners from the list, or you can approach us to get connected with them. It won't be like a timed program, like starting date and ending date. So whenever the parent institute is ready to post, usually they are open throughout the year. So you can write to them and then ask for the convenient days, and you can spend your time there. Yes, Dr. Shivam, we are happy to have anyone over here at TIPS. You will be able to see a lot of community-based work and teaching sessions, so many things. So if you can come to TIPS, we are so happy. Any one of you can come over. Just write an email to us and get in touch.
I think there is a question for Central, somebody from Mumbai, Dr. Apurva Saran. You will need to contact Sunanda. We've just shared the number for you. She will help you get through the drug controller, apply for RMI, and also help you with the follow-ups.
Dr. Shivraja, Sri Lanka, I think we had a few relationship with a few doctors in Sri Lanka. I will just inquire whether they can. So all this list has centers in India. So now we are thinking, yes, there are people outside India also. Sri Lanka, we had a few people who are working in palliative care. So we'll see whether they have any options for hands-on training, or we can always travel to Kerala. It is not too far from Sri Lanka till we get some details. We had a few participants from Sri Lanka coming over to Kerala for 6 weeks and getting trained. So we have to go back and ask whether they can host some hands-on training program also.
Dr. Shivam, what you're asking for is little dicey. We will not be able to share the number of the drug controller with you right now. That's something officially which is not allowed to us. But however, we would like to extend our support in any way possible. And even you can write an email to them. That is, certain numbers are available online. So you can just go through that. But in person, if you really want to submit, our facilitators would be the best people to help you.
I think Dr. Sriramu has asked about the videos. Yes, the videos will be available in the future for reading and reference. Just in case if the site crashes or some technical issues happen, you can write to us. We'll be sending the latest recording link whenever you need it. Because sometimes, in YouTube, they just take it out. So you don't realize. So if you are not finding the video on a particular topic, just write to us and we'll be able to share the recent link or recording, whichever is available. Access to any reading materials or knowledge will be available because you have a WhatsApp group. So any mentoring, any doubts. So all these access are always available for all of you.
Any other practical questions you have, like for your state? I'm happy to answer. If what is the current status in your state on availability of opioids?
No burning questions.
Yeah, Dr. Nilaksi, Telangana is a very, very positive state in terms of developing palliative care. M&J Cancer Institute has played a big role in ensuring that palliative care is available, at most of the government centers. And the drug controller is also very helpful. So whenever we do not have direct contact with him right now, but we always collaborate with Dr. Gayatri Palat and then reach out to them. So I think we can connect you to them. They are issuing our advice. So that is your question. I think we have a hand raised for Dr. Apurva.
Thank you, ma'am, for taking the question. Ma'am, I have a couple of questions. I am very, very new to palliative care. One of my colleagues, she introduced me to, and she mentioned that you can really get into it and it's beneficial for people along also. So I just wanted to know, one, what is the duration as you're mentioning about the workshop? That is one question. How long is that workshop being conducted for? And second question is how immediate or how much training is required before we actually start taking palliative care on a I would say a commercial basis, or probably start taking palliative care for patients across, or you should be trained enough for a year, 6 months, 2 years, or how much is that duration as?
I think I'll answer the first question and probably a little bit of second, and then Dr. Sridevi, because it's more on training, so she can guide you further. Firstly, for the workshop, this is more for the officials and for an administrative purpose. So we invite the drug controller and the medical fraternity, so we cannot really go beyond an hour. We generally try to keep it for 1 hour. And then if the discussions go on, then sometimes it goes on for 1.5, 2 hours, because people have so many questions and they have the drug controller right there to answer. And sometimes the association of chemists and pharmacy are also join in. So that is really helpful. So one I can suggest is, if you want to be part of it, we have one coming up on May 9th for the state of, if anybody here are from, for the state of Jammu and Kashmir, Haryana, Chandigarh, Himachal Pradesh, and Punjab. So these 5 states together we are trying to do on May 9th. We have confirmation from Haryana and Chandigarh drug controllers, so they would be joining. We are not yet sure about the other 3, but Dr. Raj would be taking that 1 hour talking about it, and then taking the questions from both doctors and officials.
Okay, so technically it's a one-day workshop, 1 day, 1 hour workshop.
Yes, it's just 1 hour, but we'll send you a proper agenda. You can share it with your team. We'll organize it for you. That's no issue at all. Yeah. The other question, legally, as such, nowhere it is said that how much training is needed. So people do go in for, even after 2-3 days of palliative care training, they feel that they are ready to practice palliative care. But as a WHO collaborating center, we have always advised to go undergo at least minimum of 10-day foundation training, and then a lot of practice of patient assessments before you really take it up. I think Dr. Sridevi can and Dr. Radha can add on more on that.
Yeah, I agree to that comment. It's about like, if you really want to practice on the ground, probably you may need to spend time like at least 10 days, and then some hands-on training. This 10 days includes hands-on training also. There is like no strict rule. There are people who do very short courses, but then probably you may not be able to recognize on your own when, how, what, and everything. So it will be a good idea to do at least 10 days course before we start to take up on it.
All right. So, ma'am, does Pallium India provide any kind of training courses as well?
Yes, we have residential programs. We have 10 days foundation course, which is the next batch is starting on this Monday, and the next will be in July. That will be 10 days training program. We have 6 weeks training program, which will be more of an experiential learning. That is a complete package. You will be ready to start on your own, literally, because that's more intense training. You will have a lot of exposure in the community with the non-medical teams. You will understand how work is being coordinated by the multidisciplinary team. Of hands-on experience will be more. So that those are the 2 courses that we conduct, and 1-year global fellowship program, which is a year-long program with 30 days of contact period at Pallium. So if you follow our social media pages, whichever course is coming up, we'll be notifying that in all these social media pages. So with the registration link and everything, so you can choose whichever time is working for you.
All right. Thank you so much, ma'am.
Thanks for the question. I think there are a couple of more questions relating to opioid availability. So one question says, how many days prior to starting a palliative care center should we apply for license? I would suggest, as you're applying for other licenses for your establishment, start applying this. But the practical sense that we received from a new hospital recently was that once your hospital has started taking patients, I think, and you will have an understanding of how many patients are you expecting in the coming year, and how many patients would be palliative care patients, and what extent of your the departments have started, and whether they are ready to handle patients or not. So I would suggest settle down first and then apply for RMI license, so that you have everything in place, setup is in place. And because in any case you'd apply, it's a mandate that within 60 days, the drug controller has to issue an answer back to you, or reply to you within 60 days. So I don't think it will be delayed. But in the beginning, first set up the whole place and then apply for RMI. The next question is from Dr. Daisy. David, you are right, Dr. Daisy. The rules are all same, as Dr. Savita also mentioned. It is all same in all over India. But again, because of the misuse that has happened in the past and because of the fear of misuse, a lot of state drug controllers put their own rules into it. That is what we are trying to keep away, and we are trying to educate drug controllers not to hold the licenses. So you can still apply because you are in a rural hospital. So if I'm not wrong, is it a government hospital? If it is a government hospital, then you need not apply for it. You are trained. You can just simply place the order to the vendor. Or the government hospital has an internal system of, I think, procuring through your internal medical supply. And a lot of states have already put it on essential drug list, morphine and fentanyl and all that. So you can apply for indent through that thing, or set a consignment request to any of the vendors directly. And if you are a rural hospital like a Manual Health Association or something, you would require an RMI, and you will have to apply to the drug controller. I hope that answers your questions, Dr. Daisy.
Any other queries?
So I knew Dr. Daisy in the EHA. So Dr. Daisy, we have helped a lot of EHA hospitals in UP to, I think there's one in Fatehpur, probably there is one in, I'm forgetting the places, but we have already helped them in getting an RMI. So Rajendra ji is pro in that now. You can just reach out to him and he'll help you with the RMI application. Any other questions from anyone? Just on a last note, if there are no questions, if any of you, I know your doctor's study itself is so much that you keep reading and studying a lot of stuff, but if any of you are interested and you want to read through the legal documents of this for your own knowledge, we are happy to share. I think we'll be sharing those NDPS documents with them. So there is a whole list of documents. You can read through it. It has a amended act, which will tell you how it has changed. So if by chance there are certain questions in your mind which come later on, so you can take that document to your drug controller, show it to him and say, this is the document which tells me that this is RMI. And generally it comes with the gazetted emblem, Indian emblem on it. So they realize that you have read your, you have done your homework, then only you are coming. So they will not ask you any not required questions. So we do have those documents if you want to read through them. I think, Dr. Sridevi, the question is for you. Online course for pharmacists or physiotherapists?
We do have online course for physiotherapists. For pharmacists, I think IAPC is doing courses for pharmacists, Indian Association of Palliative Care. They are running short, I think it's a 3 days program for pharmacists. Physiotherapists, yes, we do have training programs. So in the coming days, whatever training programs we have, we'll be sharing that in the WhatsApp group and in our social media. So just whenever we send messages in the WhatsApp group, if you open and see, there'll be some refresher course or specialty based training courses. Everything will be updated in the WhatsApp group. Dr. Ira, occupational therapist, no, because we don't have the expertise of an occupational therapist in our own team. So we don't have a training for occupational therapist, but we are happy to include them. If suppose as a start, they can be a part of the volunteers training program where they will understand the basic concepts, but not specifically for occupational therapist.
There are no more questions.
And we'll hand over to Sri Priya then.
Thank you. Thank you, Dr. Sridevi and Shalini, for being with us here. And I believe that brings us to the end of the Q&A session for this session and the entire program as well. Now the platform is open for feedbacks. We would love to hear from you on areas of improvement specifically, so that we just want to know what went well, where we could have done better. So it's open to you. Any volunteers first?
So I'm Dr. Ira from Goa. And I work in the government, as Shalini said. So we have started in January, and we have close to 1,000 patients registered with us, and we do about approximately 100 home visits a day. So this program has actually really given me a lot of confidence, because earlier I did attend several one-off kind of lectures, but it didn't give me the confidence to start morphine or to do other pain management. So I think the lectures were in-depth, the assessments had application-based questions. So one suggestion is to have a little more on non-cancer palliative care, because like in our practice in the government setup, we have 80% non-cancer and only 20% cancer. I'd also like to know, like following this foundation training, is there any next stage training for us who have done this online, if there's any other online training? So I asked about occupational therapists, because now I have an occupational therapist and a physiotherapist, but I just wanted them to be like trained with the palliative phase of physiotherapy and occupational therapy. So if there's any such thing for them. So once again, thank you very much for making me a palliative physician now. And I did enjoy the whole program very much. Thank you.
Thank you, Dr. Ira. Thank you so much for your kind words. Regarding the advanced online courses, yes, we do have courses coming up regularly, the refresher course, and we will definitely keep the group updated once they are announced in due course of time.
And there are additional like pulmonology and palliative care, nephro palliative care. There are so many other things also happening. If you're interested, you can attend those also and see, because they'll give you a link, an idea on how, where other areas also in depth you will know. So keep an eye on the website, and many such programs keep on happening, and you can go on with that and do some more hands-on also if you're interested.
Waiting for feedbacks. We have a couple of, can we have the chat on, please? Dr. Radha, you are muted.
They've asked whether you update everything on Twitter or what. That was one of
We
the...
do. Yes, of course, Pallium India does have an official Twitter account. Along with that, the Education and Skill Building Department of Pallium India is having one account, but unfortunately, we are struggling to update it on regular basis. And very honestly speaking, we stick on to the traditional WhatsApp for sharing of information as of now, mostly. So we would humbly request you to stay tuned with us in the WhatsApp group, as well as the individual status which we are posting in our WhatsApp accounts to get the complete details. Yes, of course, the Twitter is there, but then Twitter is there, LinkedIn also is functional as official account, but then at times it's better to keep checking the WhatsApp post. Okay, Dr. Shahina has said it gave an immense knowledge for newcomers like me about palliative care in a short period of time. Dr. Nilaksi, yes, of course, we will also be missing the classes, but then the life goes on. As we say, we have more people coming in and we need to train everyone in palliative care. Any other comments, feedbacks? Can I just request everyone to switch on their videos at least for the last 10 minutes, because most of the time me and Radha ma'am have been looking at blank screens and names. So anyways, it might be a long time before we see each other in person. So those for whom it is possible may kindly switch on their videos. That would be great.
Shruti, if you allow me to say something right now, I'm so
Sure.
sorry. Because I realize this is the last session for this group. I just wanted to say, not just for the RMI, because the next thing is probably you would want to start opening up a palliative care center, or you would want to start a center in your existing setup. So if you need any help beyond the opioids also, what is the budget of running a palliative care center? What is how we should procure other licenses, or how we should really open up a center, who all needs to be trained, who all should be there to coordinate the whole thing with you, please feel free to reach out to our facilitators. They would be happy to support you in any way. Even if you want to do it in your community setup, or want to have a volunteer group engaged in that. So all kind of initiatives, we'll be happy to work with you on that. Just wanted to add that. Thanks.
Thank you, Dr.
Ma'am, is there any, qualification for a social worker, palliative care?
Not exactly, Doctor. What we suggest is the person should be trained in palliative care. Like in Pallium India also, we are running a program which we recommend for social workers, that is foundation course in palliative care. But more for a psychologist perspective or counseling perspective, there are separate courses that you can do. There is no specific palliative care counseling that is available. But I think Dr. Sridevi can add more onto that.
Yeah, same thing. Any counselor or social worker can undergo our foundation course in palliative care. So they'll already be knowing counseling and social work and stuff. So we'll be adding the palliative care perspective to it. So we have regular sessions for them, which is called FCPC. I think one batch is already going on. So after, it happens regularly. I think 3 to 4 times a year. And even after the course, the WhatsApp group will be there. So if you come across any patient, if you want to have a case-based discussion, we do get calls from participants, previous participants, and we have a telehealth facility available. So they'll be able to guide you through the management and assessment and management, whichever aspect you feel you are stuck. Or as Shalini said, any management or issues to start something, to coordinate things in your place, whichever way that you can reach out to patient, will be there to help you with that.
Thank you, Dr. Puneet, for specially mentioning my name. Happens very rarely, but I'm so happy. And thank you, Dr. Vishnupriya as well. Okay, we have a couple of comments coming in. Dr. Premalata says it gave me confidence and also inspiration to start the palliative care setup. Thanks to Sripriya to clear my doubts anytime. Of course, only non-medical. All the presenters, Dr. Sridevi, Dr. Radha is of course, I should mention Dr. Radha here because I should personally thank her also, because I have been making her go on a double duty recently. We are on a 6-day shift right now. Monday, Wednesday, Friday, one batch, and then Tuesday, Thursday, Saturday, one batch. And she's literally doing it as a free service. She's volunteering without taking a penny from us. And whenever she has some personal work, she messages me so humbly that Sripriya, I'm so sorry, I could not exclude that. That is the way she handles things. Thank you so much, Radha ma'am, for being with us from the start till here.
And I think everyone knows that she's joining from UK, right?
I had mentioned it a couple of times. Not sure whether everyone had paid attention to. And the thing is, I never take into account the difference in the time zone whenever I message her. Because many a time the case presentations come in late or there might be last minute changes. I never look at the time. I just message her, ma'am, this is the situation. And she responds back. I'm not sure when she sleeps or eats.
It's really a pleasure to be with all of you. So I'm part of Pallium family, no? So we have to be one and all. So really, really nice. So whatever is possible, we are trying to do. And main thing is that as Dr. Rajgopal wants, we want palliative care to go to everyone in India. That's the aim and goal. So for that, whatever we can try and do, we will. And then Pallium is helping. I'm just a little one linking here and there. That's all.
Of course, not forgetting Kenya and Sri Lanka because we have people joining in from there as well.
Yes, it's really a nice platform. See, from different parts of the world. And it's such a nice thing. Globally, palliative care is very, very less. Morphine availability, everything is like that. So it's a joint effort to be successful. For ultimate result is patients, in the patient's best interest.
I'm still to get at least 1 point for an area of improvement.
So what she mentioned, no, whether to add on a little bit more, we do have non-cancer palliative care. Maybe a bit more if they want that. That was a good suggestion, Sripriya, I think. So maybe we can look into that if that was needed. We do cover, and simultaneously we do say where cancer patients and where non-cancer. So both we do say, and then many chronic pain issues, no? So we need to be aware of that also, and appropriate management.
I think what we have done is, like, when you get into non-cancer, it is very vast. You can't include all those non-cancer in this foundation course. So as Sripriya mentioned, we are coming up with like ma'am mentioned, short sessions. Like we have course for pulmonology and palliative care, where you will be able to understand that aspect. Renal and palliative care. We'll be coming up with geriatrics. All these are separate sessions, not included in the foundation course, because that itself is a huge area. You can't cover it in one session. And in the refresher course, we are touching upon cardiology, neurology, renal, spirituality. So the next level to about what you have learned from this course. So that's an entirely different course that we are doing. Practically, it is very vast to include in a foundation course.
You're right, Sridevi. Ideally, I would say if they can just come over to Pallium and see for like 1 week or 2 weeks, go with the team for home care, they will do. So practically that's what, and then it all depends on what is your field of work, what is your expertise, and what's your experience. Based on that only, this is something like the whole world is facing. So, and then everything can't be taught. So bit of experience, everything comes into it.
Yes, Dr. Puneet, your point is well noted, like having breakout rooms in between. The only practical doubt we are facing is many a times, of course, the size of the group, around 50 people joining in at a time. So one group would be around 10 to 12. We divided it into 4-5 groups. And then many a time, since this is a completely doctors group, some people might be busy in OT, some people might be busy in their OPs. So we all know the practical things. They might not be able to interact when it is required. So at times it may end up other personals feeling that they are alone in the group. So that is why and then there is a time limitation of 1.5 hours where we are giving only 40 minutes for the faculties to present their points. So that is why we have not thought about the breakout rooms in the foundation courses till now. But yes, of course, if and when the situation is good, we can definitely consider that. Yes, of course, Dr. Premalata, you can definitely connect with us whenever you want regarding any doubts. We do have multiple channels, like the WhatsApp group is already there. You all have our mail IDs to get in touch with. You all have our WhatsApp numbers or personal numbers. And then we have the telehealth number provided by Pallium India, who gives the service. So all these options, yes, of course, you have. Dr. Dia says, thank you so much for the sessions, very detailed, and as a news graduate, it was very insightful. And to understand more about palliative care and its working, which is extensively covered during our UG curriculum. Many thanks to Sri Priya, who has always respond to any queries regarding session. Thank you, Dr. Dia, for those kind words.
Just before winding up, before I forget, probably anyone of you working in medical institutions, we are conducting faculty development programs virtually with limited scholarships also. So if you are associated with a medical college, please let us know by email or in the WhatsApp group. We'll be sending you the program schedule. You can bring in your team on board, a few members from your medical college for the faculty development program. So just let us know if you are interested to have that conversation.
Any other? I think we can formally wind up the session if no one else has anything to say. So thank you everyone for those kind words and being part of us over these 20 sessions, being with us. Of course, this is not the end of any journey. This is just the start. We have handed over you the baton of palliative medicine, which we expect that you spread it across to the people near you who need relief from pain. And we do expect that this network grows larger and people around the world get pain relief where they require it. Radha ma'am?
Best wishes. Best wishes to one and all. Okay. All of you can do it, happily do it, and you will be able to get it done nicely. Enjoy your work and do, and Pallium is always there to help you. All of us are there. Get in touch and then we will help you as much as we can. So enjoy your work and be successful in whatever you do.
Thank you, Dr. Sridevi, and thank you, Shalini, for joining in. And just reminding, as per my official duty, that we still have one more assignment to go, and then we have some assignments to be cleared before the final list of certification is out. This is Sri Priya, along with Dr. Radha Venkatesh, Dr. Sridevi, and Ms. Shalini, along with Mr. Anup, signing off for the last time from the Tips Echoes Hub. Stay connected in WhatsApp and mail. Stay safe, everyone. Be safe. Bye-bye.
Bye.